With dry eye, that's one of the leading problems that we see in the practice. Dry eye is a very bothersome condition. There's actually been a lot of studies that show from a quality of life standpoint, dry eye ranks just behind chronic back pain, as it inhibits your ability to read for long periods of time. It can decrease your productivity at work because of computer problems, computer vision syndrome, etc. It can make troubles with wearing contacts, where patients have to come out of contacts that they've been in for a long time. So when we talk about dry eye, we have to kind of understand what's actually occurring. When we look here at your tear film and how it works, up in this area here, this is where your lacrimal gland produces the majority of the tear film. The tear film is actually made of 3 different layers. It has a thick kind of mucousy layer on the outer edge, it has a thick water layer on the middle section, and then a very thin another mucus layer on the bottom. Each of those serve different purposes. The lacrimal gland produces the watery layer, and then these little bitty glands that you see here, and we can kind of magnify this to kind of look at it closer, you'll see little tiny little glands along the bottom margins here, okay? These secrete that last bit of mucus layer that helps to hold the tears on the surface of the eye. So when that occurs, you get a nice stable tear film that, regardless of the environmental conditions, won't evaporate off the surface. Patients that have problems with dry eye will often experience things like redness, burning, irritation with contact lenses or in windy conditions, intermittent blurry vision. And what I typically tell patients with that is you might be reading in a book or something and the first part of the line starts out fine and by the end it's all blurry. You find them blinking, rubbing their eyes, etc. to try to get the vision clear again. With those things, we can treat that in several different ways. Sometimes we use nutritional supplementation in the form of omega-3 fatty acids, which are natural anti-inflammatories. Other times we'll use things like over-the-counter eye drops, different drops that patients can use to re-wet or replenish the supplementation of their natural tears. Sometimes we use prescription medications like Restasis. Restasis is a great medication that we use on a lot of patients that will actually stimulate that lacrimal gland to produce thicker, stickier tears on the eye, so you don't have to use artificial tears as often. And then finally, we can also use things such as punctal occlusion. And what that is basically where we go in and we actually use a plug to block the drainage canal. So you put this very in-office simple procedure that we do that will actually cause the tears to back up on the surface of the eye to reduce some of those symptoms that patients often have. So we have a kind of approach to dry eye, and each patient's a little different, so we have to kind of figure out, number one, what's causing the dryness, and then number two, what's the best approach to trying to treat that problem for the patient so that they can be more productive at work and at home doing their hobbies.